COVID-19 cases are surging in Myanmar. After 6 months of military rule, only 40% of its healthcare facilities are open. Doctors and nurses led a civil disobedience movement against the military takeover, drawing the ire of the junta. Now many medical staff are afraid to turn up to work, further straining Myanmar's beleaguered hospitals. Test and trace systems are faltering due to public mistrust in the new establishment. Faith in medical care is waning, further boosting COVID spread. Faced with such difficulty, Myanmar's citizens are finding their own ways to care for each other. This is your COVID-19 special here on DW. I'm Janelle Dumalaon. And as people in Myanmar find themselves unable to rely on public services to help them deal with the surge, other sectors of society are stepping in to fill the void, including places of worship.
It's just after dawn in Yangon, Myanmar's largest city. In front of this mosque, the line for oxygen refills slowly shuffles forward. People have already been waiting for hours, desperate for medical oxygen for loved ones with COVID-19. If we want to get oxygen, we have to come here early. Even though I came here at around 4 in the morning, I had to stand back in the line, as some people had already arrived. For many in Myanmar, treating COVID-19 is a do-it-yourself project. Oxygen and hospital beds are scarce. The mosque decided to offer oxygen as a way to help. Initially, we thought of distributing meals to COVID quarantine centers, like we did last year. But we changed our decision as we saw people in desperate need of medical oxygen. It's available here free of charge. Religion, ethnic background doesn't matter. All who wait are served. It's a lifeline, as most people here can't afford to pay. Prices have more than tripled with the infection surge. The military government has not been able to effectively manage the health crisis. Authorities are now even forcing oxygen factories to close. So we're struggling to get enough supplies to refill the oxygen tanks. At public hospitals, there aren't enough medical facilities, and they're finding it hard to cope with the demand for oxygen and other essential drugs and equipment. With the country in crisis, these Muslim volunteers say they want to join with the Buddhist majority in the fight against COVID-19. We're worried because we're Muslim and a minority here. Frankly speaking, we're concerned about the potential threats against us. We just want to fill in the gap and help people. And many in need are taking up the offer, as they have nowhere else to turn.
Min Tant is a journalist following the situation in Myanmar. They join us from Bangkok. Welcome. We just saw in the report there that dealing with COVID-19 in Myanmar is pretty much a do-it-yourself project. Is that accurate?
Yes, many people are self-treating COVID-19 at home. In the last few weeks, we've seen people taking to social media to try to either beg or look for oxygen and other medical supplies. We've seen huge lines at oxygen plants as well as, unfortunately, crematoriums. And part of the reason for this is because people are not being admitted into hospitals, which are functioning at very low capacity right now because of the civil disobedience movement and just people's distrust of anything controlled by the junta at the moment. And because of the situation, people are not being admitted until they're at very low oxygen saturation.
Now, as you said there, the United Nations estimates that only 40% of Myanmar's healthcare facilities are still able to function. You've spoken a bit about this already, but how else does this manifest on the ground?
Yeah, so I think when we think about that 40% number, it's also important to remember that even at 100%, Myanmar did not have amazing healthcare infrastructure, and many people, especially people who are very low income, were not getting very good medical care to begin with. And because of the coup, because of the civil disobedience movement, people are not really able to seek medical help at government facilities. Many people are not willing to go to government facilities, and even those who do are seeing huge lines because healthcare workers themselves are boycotting these facilities. And so you see many people getting turned away, even for very routine things, not related to COVID, such as just regular dialysis treatments, things that shouldn't be life or death situations, but are beginning to turn into such. And we're seeing many healthcare workers who are now in hiding and trying to provide care through alternative means, but are seeing pushback and persecution by the junta.
What kind of persecution are we talking about?
So because healthcare workers are a huge part of the civil disobedience movement, which is the sort of main nonviolent movement against the coup and the junta, many doctors, nurses, other healthcare workers have themselves imprisoned in recent months. We've seen soldiers essentially do sting operations where they pretend to be patients to try and lure doctors out of hiding and then arrest them. The head of the COVID response under the civilian government is also in jail, and we're seeing many, many doctors who are not living in their homes anymore, who are now sort of either staying with relatives, trying to find safe houses, and other means of trying to make sure that they are not in places where the junta would be able to find them.
Certainly a very difficult situation. But can you tell us, how are vaccines reaching the people in the midst of all of this?
So a little over 1.7 million people are said to be vaccinated, according to the junta's health ministry, and a little over 2 million people have one vaccine. And this is in a country of 54 million people. And so, it's a very low percentage of the actual population. And vaccines are being offered right now. 1.1 million vaccines arrived in Myanmar over the weekend, but a big part of the problem, this legitimacy problem of the military, is that people who are already vaccine hesitant, because many of these vaccines are Chinese-made vaccines and Russian-made vaccines, are unwilling to get these vaccines because of concerns about these vaccines. But we're adding to that another layer of hesitancy because people don't trust the military to provide proper health care, or they don't want to be seen as kind of acquiescing to the authority of the military as a service provider.
Now, speaking of trust in the military, they are, of course, the ones also coming out with the numbers, and official estimates put COVID-related deaths at 14,000 in the country. Now, would you say those numbers make sense?
No, I mean, I think, pretty much everyone agrees that those numbers are a huge undercount. One example of this is that over the weekend, there were about 400 deaths reported. But throughout this crisis, or in the recent weeks of the crisis, we've seen huge lines at crematoriums, at cemeteries, places that were used to processing 60, 70 people a day. And so if we're adding all those numbers up, in Yangon alone, at certain points in the crisis, we were seeing estimates of 500-600 people dying per day, and those numbers are nowhere near what the official the records would indicate.
Min Tant is a journalist following the situation in Myanmar. Thanks for joining us.
Thank you.
Time now for one of your questions. Over to our science correspondent, Derek Williams.
Are the viruses related to SARS-CoV-2 that cause SARS and MERS also airborne pathogens?
It took time and a whole lot of studies before healthcare authorities were certain enough to come out and state clearly that SARS-CoV-2 is primarily spread not just via larger respiratory droplets exhaled by infected people, but also via smaller aerosols. That's because the means by which a pathogen is transmitted can be a really complex thing to prove, especially when it infects others by hanging suspended in the air. But a lot of the evidence we have can't really be explained any other way, and studies have now made it the theory that most experts agree on when it comes to SARS-CoV-2, that it's transmitted from infected people to others via droplets and smaller aerosols, mostly indoors in poorly ventilated rooms, especially if those rooms are crowded and people spend long periods of time there. What we know about transmission in the coronavirus that causes SARS is a lot more limited because only around 8,500 people have ever had it, and all of them were infected almost 20 years ago. But experts think it's more difficult to transmit. The CDC says that the SARS coronavirus spreads mostly only through larger respiratory droplets during closer personal contact, either directly or via surfaces contaminated by those droplets. That and another major factor, that sufferers are mostly infectious only when they have the full-blown symptoms of the disease, that helped authorities get SARS under control through strict quarantines. When it comes to MERS, we know even less about transmission than we do with SARS because even fewer people have contracted it, which means even fewer opportunities for study. But it's believed that people can catch it directly from animals, and camels are a prime culprit. A human-to-human spread is also possible through close contact, but as far as I can tell, no one has yet identified the exact mechanisms of that spread.
Thanks for watching. Stay safe and see you again soon.